Bismillah, alhamdulillah, wassalatu wassalamu ala rasulillah. Rabbi shrah li sadri wa yassir li amri wahlul uqdatan min lisani yafqahu qawli. Assalamu alaikum wa rahmatullahi wa barakatuh. So I get a lot of questions about how to deal with young people who are using substances. So parents understandably approach me in a very distressed manner because they found out their son or their daughter, usually a teenager, is using illicit substances like cannabis or drinking alcohol. So I just wanted to do a video to give some recommendations and advice on how to manage this crisis. Before I do that, I'll just go through some data in terms of epidemiology, how prevalent is substance abuse in young people. There's a lot of data out there, particularly from the West, the US and the UK. So focusing on kind of the UK, the evidence shows that the commonest substances that young people abuse are alcohol, smoking, tobacco, and cannabis. And other substances like cocaine and heroin, they account for less than 10% of young people using drugs. 40% of 16 to 24-year-olds have used illicit drugs at some point in their life, and 12% used illicit drugs in the preceding month to surveys that were done. Another common substance that young people abuse are volatile substances or solvents, such as butane gas or carburetor spray. And this peaks in early adolescence, and it's higher for young people who come from socially deprived backgrounds. So around 1% of young people report inhaling solvents. There's also now an increasing problem of synthetic drugs or legal highs, and also kind of synthetic cannabinoids, and more research needs to be done about that. So in terms of like, why do young people use drugs? Again, there's been a lot of research about that. And taking a developmental perspective, young people report different reasons why they're using drugs, like for pleasure, for peer pressure, to kind of conform to the values and attitudes of their peer group. Some people use it to kind of escape from difficult, painful, traumatic memories, and also self-medicate for things like anxiety and depression. A study by Annabelle and colleagues in 2001 said that the most popular functions for use in young people was to relax. 96.7% reported that of young people. To become intoxicated, to stay awake at night while socializing, to enhance an activity, so using stimulants, and also to alleviate depressed mood. The risk factors for developing harmful substance abuse is early onset and rapid progression. So the earlier or the younger kids are when they start using drugs and rapidly progressing from one drug to another, these are bad signs. And the age of 14 to 18 is kind of the highest peak of drug and alcohol use. And most young people reduce or stop by the age of 24. So really, in terms of advice on how to manage this, first of all, it's really important. Prevention is better than cure. So we need to speak to our sons and daughters, young people, about the harms of substance abuse, give them knowledge, because many of their friends will be using, and they'll be experiencing peer pressure to use drugs. So we need to have a good communication with our children, have good understanding of the fitna and the difficulties that they're going through. And then, so that's really key, so that they can come to us as parents and discuss anything that is bothering them and troubling them. The next step is, if you do find out that your son or daughter or nephew or whoever family member is using drugs, is not to kind of explode and start shouting and kicking off and, causing obviously it's distressing as Muslim parents if you do find yourself in this situation, but really is to keep calm, take some time, and then sit down and speak to the young person, to your son, your daughter, and really explore kind of the reasons why they're using, and how you can help. And really, it's about kind of providing nurturing, supporting environment, because if you, as many parents do, if you explode and cause a lot of issues, then they're more likely to go out of that family home and use more drugs because their peers will be providing them support, and that's not the kind of support you want them to provide. So as parents, it's really important to kind of keep calm and really talk through the issue. Now, depending on like the level of substance use, usually it's experimental. So they may have used cannabis or drunk alcohol kind of socially, but in other people, it might have progressed, depending on how quickly you pick it up, it might have progressed to kind of harmful use and dependence, where they require specialist treatment. Most of the time, it's kind of experimental social. So it's about giving them the information about the harmful use and obviously bringing them back to Allah in terms of connecting them to the Salah and the Quran and encouraging them to, have good friends who are not using substances, who are praying and are good Muslims, because that's really important. The peer group and friendship group is really important, and that's usually enough. It may be like seeking some help from a psychologist or psychiatrist. And asking them to, speak, because what I find is that young people usually take information better, like from me, as an example, or somebody outside of the family. Whereas, with parents, there's quite an enmeshed and complex relationship, so that can be a challenge. And then, yeah, if people are uh, experiencing negative psychological and physical health effects because of drugs, then they need specialist treatment from a doctor, a psychiatrist who specializes in addiction. In terms of treatment, there's lots of treatments we have: psychological therapies, talking therapies like CBT, and also medication might be required. So the alcohol patients may need a detox depending on the level of alcohol they're drinking. And unfortunately, now there's a heroin epidemic, so a lot of young people are using heroin and becoming addicted to opioids, and that will definitely need specialist intervention. Okay, so that was a brief kind of discussion. Inshallah, I will plan to do some more videos specifically about each substance and how we manage and treat it. Until next time, this is your brother, Dr. Abu Isa. Assalamu alaikum wa rahmatullahi wa barakatuh.